tell you, okay, how is he doing? Did anyone tell you what has been done for him? Did you manage to speak to any of the doctors? Okay, right. So once you finish risk factors. So here there was a bleeding. So ask about bleeding risk factors. Use the MAFTOSA as analyzing risk factors. Basically, MAFTOSA is risk factor. We see MAFTOSA as a risk factor. Okay, see the MAFTOSA from today as a risk. Okay, medical related risk factor, medication related risk factor, family related risk factor, social history related risk factors. All of them are risk factors. But what is the risk? Okay, for what? Okay, we are looking for risk factors for bleeding. So, right, ask about past medical history, whether he has any bleeding conditions. Okay, then ask about high blood pressure. That is a risk factor for bursting. High blood sugar. What else could be the risk factor? Bleeding condition you ask. The patient had a peri-aneurysm. So, kidney conditions. Ask whether he had any kidney problem. Has he had any previous kidney scan? Has he had any brain scan? Past medical history. Okay, medications. For what? Bleeding. Life is very easy if you started thinking logically. Bleeding. Okay, bleeding risk factors. Okay, I mean medications. Okay, whether does he take any blood thinner medications? Open-ended question. Ask closed-ended question. Does he take any? Okay, does he take any warfarin type of medication? Any aspirin medications? Okay, medications. Okay, what is the next one? You know, family. Ask. Sorry to ask about this. Anyone in the family had any sudden collapse like this? Anyone in the family had any sudden death? Okay, ask anyone in the family had any bleeding conditions? Anyone in the family had any blood pressure related problem? Anyone in the family had any kidney conditions? For me, that is important. Okay, that is enough. Medical history, medication, family. If you ask for social and other stuff, lifestyle, this is irrelevant. Okay, that is not related to the seriousness of the situation. He is dying. In this situation, how can you go and ask whether does he do regular exercise? Okay, how is his diet? It's not necessary. Okay, not necessary. They are irrelevant. Okay, leave it, guys. Okay, then go to the social history. Okay, social history. Social history, what is important here is who does he live with? Who are the important family members? You can ask whether was he working, was he active? Whether, okay, may I know who is his next of kin? Okay, next of kin. Okay, next of kin. Then whether he appointed anybody as his lasting power of attorney. Okay, right, good. Okay. So this is the history. Once you finish, you say thank you for talking to us so far. Okay, thank you for giving those information. Okay, now you go to the psychologically, I mean, prepare the patient. Okay, because that is the approach. Okay, in order to psychologically prepare, we use this one. Invite, narrate, warn, and saying sorry. Invite, narrate, warn, and sorry with the news. Okay, the main thing is invite first, then you narrate, then you warn. Then finally you tell the news with sorry. Okay, with sorry. Okay, so invite. So, okay, let's see how to invite. So, in this scenario, you need to tell okay, the reason, the reason I'm here today, because there is an important update. This important update is not always the same. Okay, some scenario, there is something important. Because update you can tell, okay, listen carefully everything. You can tell update, okay, when you have some information The patient has got already some information. You're going to give some more information. That is update. Some scenarios, they don't know anything. In that situation, it is not an update. In that situation, it is not an update. Okay, so simply tell here. Okay, it is an update. So important update about Mr. Muhammad Ali. Okay, you refer him Mr. Muhammad Ali. Okay, tell you something. When you speak to husband and wife, it's better to refer their names, like Mr. Ali, Mrs. Jones, like that. Okay? Rather than telling your husband, your wife, your husband, your wife. Rather, okay, be respectful. Okay, husband and wife, what they need, respect. But when you're speaking to the son or daughter, father or mother, you can tell your son. Okay, you can tell your son or your daughter, or your father or your mother. Right? So, invite. Okay, how are you going to invite? I have an important update about Mr. Muhammad Ali. Okay, then I have been asked to talk to you. Okay, ask the patient, is it okay to talk to you? Ask the patient, are you on your own today in the hospital? Are you on your own? Ask the patient, have you come to the hospital on your own? Are you on your own? Okay, have you come to the hospital on your own? Don't ask the patient, are you alone today? You know, are you alone means, okay, you know, without the partner. You know, that doesn't look very good. Are you on your own? Is there anybody with you in the hospital? Okay? Ask the patient, will tell you there's nobody, doctor. Ask the patient, would you like to call anybody before we further discuss about him? Okay, that is all invitation. So what we did, I have an important update. I have been asked to discuss with you about Mr. Muhammad Ali. Is it okay to talk to you? Is there anybody with you? Are you on your own today? Would you like to call anybody before we further discuss? That is all invitation part. After the invitation, you go to narrative. Narrative is storytelling. What is narrative? Narrative is storytelling. Okay. Narrative is what? It's storytelling. Narrative. Narrative is basically telling everything happened in a chronological order. Okay. Before this state, there may be something previously. Okay. So narrative is the storytelling. Your storytelling has to be very good. Okay, a doctor should have this storytelling ability. Okay, storytelling is organizing the information and explaining them clearly. Okay, that is storytelling. Okay, the narrative. So here the narrative is basically okay, what you have asked in the history, you put it together. It is a warming up phase. Okay, so every narrative starts with as we understand. How it starts? As we understand. So as we understand, you can tell Mr. Muhammad Ali unfortunately collapsed today. You see, it collapsed. I didn't simply say he collapsed. I said unfortunately he collapsed. Why? My instinct naturally detected, okay, it is not a very pleasant thing. So I need to say it with a little empathy. This is real, okay, interpersonal. Your instinct also should be able to detect things. When you speak, naturally, as a habit, you need to have this. Okay, yeah, you have to develop this. You have to train yourself. Okay, that's real interpersonal. If you are not really in that, they will catch that in some place. Okay, right. So unfortunately, tell Mr. Muhammad Ali collapsed this morning, as we understand. Okay, Mr. Muhammad Ali, unfortunately, he collapsed at home today. at his home today. Then I understand that he called the ambulance. Then he was brought into the hospital. Till he was unconscious. Then he was assessed by a team of specialists. Okay, team of specialists, okay, brain surgeons have assessed him. Then we also have done a CT scan. So the history taking is basically, okay, the history taking is basically, sorry, not history taking. Okay, the narrative is basically part of the history taking, part of the scenario, that information given in this task. Okay, what do we say? Then at the end of the narrative, we also have done a CT scan. Now give a warning shot. Okay, now you're going to give a warning shot before you tell the news. Okay, how we give the warning shot? Always learn to give a one learning shot, one way of doing it everywhere. Okay, one way of doing it. Okay, this warning shot. Right? Learn one way of giving warning shot. Tell, I'm afraid. The warning shot is always about the testing. Either about CT scan, about the scan, or maybe examination. Okay, usually scan or biopsy, or sometimes examination. So it tell, unfortunately, I'm afraid. Give a warning shot. Okay, unfortunately, I'm afraid I don't have a very good news regarding the CT scan. So what are you going to say? I'm afraid, unfortunately, I do not have a very good news regarding his CT scan reports. So how to give a warning shot? I'm afraid, unfortunately. When you say these things, then you need to have an empathy. Okay, you need to raise your eyebrows, to have the wrinkles. Okay, you need to feel that pain. If you don't know how to show that pain, pinch yourself. Okay, when you pinch yourself, the pain will reflect on your face. Okay, some people don't know. Okay, oh, if your practice partner is showing not empathy, pinch. Okay, it will come on your face. Okay, then 2-3 times you need to pinch. 4th time you don't need to pinch them. That memory will bring it. Okay, right. So I'm afraid, unfortunately, we don't have a very good news. Never ever say, I have a bad news for you. Okay, that is not very good. Always speak in a positive way. I'm afraid, unfortunately, I don't have a very good news. Okay, I don't have a very good news. I'm afraid, unfortunately, I don't have a very good news. Okay, regarding his CT scan. Regarding his CT scan. Okay. So I'm afraid, unfortunately, I don't have very good news regarding his CT scan. If we give a warning shot, don't speak anything else. Some people give a warning shot, then they try to contaminate. Okay, how do they do? Like this. I'm afraid, unfortunately, I don't have a very good news regarding the CT scan. Would you like to call somebody? Would you like to call somebody? We finished this. Already we finished. Actually, when you do the warning shot and ask me, would you like to call somebody? That is also a tiny bit of warning shot. Patient will start thinking. Usually, doctors, they don't call anybody. Why they wanted to call, okay, somebody, okay, for me today. So, okay, so don't ask them to call again, okay? Here is a clean, plain warning shot. I'm afraid, unfortunately. Okay, we didn't receive a very good news in the CT scan reports. But you have to raise the eyebrows and say it. Okay, with empathy. Then you finally tell, I'm really sorry to tell you. You're going to tell the news. Okay, if you give a warning shot, don't delay too much. I'm afraid, Mr. Johnson, unfortunately, I don't have a very good news regarding his CT scan reports. I'm really sorry to tell you, the sorry has to come before, not later. I'm really sorry to tell you. Unfortunately, he suffered from a major bleed in his brain. Okay, you need to say it with empathy, but empathy with energy. Empathy with what? Energy. Okay, empathy you show it with energy. Unfortunately, I'm really sorry to tell you. The sorry has to come before. Okay, unfortunately, I'm really sorry to tell you. Okay, he suffered from a major bleed in his brain. Unpause it. When you say the news, you have a very good empathy. Okay, raise your eyebrows, have the wrinkles over here, and you say it. Okay, so unfortunately, I'm sorry to tell you. Okay, 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 he suffered from a major bleed in his brain. And you pause it. Okay, this is called golden pause. You need to be silent after the news. And it's called golden silence. Okay, then you pause it. Okay, you pause it and wait. Okay, wait for the reaction. Okay, so once you have delivered the news, you need to be patient. Okay, some people after delivering news, they get anxious, they start talking. No, you just pause it. That's why it give a different phrase for that, golden pause. Unfortunately, I'm sorry to tell you, tell that, okay, unfortunately, I'm sorry to tell you, he suffered from a major bleed in his brain. And look into their eyes and wait. Okay, you tell them that, this is a game, guys. You are playing a game. You are telling them, you are signaling, okay, I have moved my chip. Now you move yours. Okay, like I've done my part. Okay, tell them, okay, where is your reaction? Show me a reaction. You wait for them. How they're going to respond to that? How will they respond? Let's say they can start crying, for example. Okay, crying. Okay, 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 right. Pause. Let's say they started crying now. Okay, they started crying. Okay, they started crying. What do you need to do? First, you let them cry. But you have seen the tears. Okay, first let them cry. You have to give them some time. Okay, let them to cry. Okay, okay. So, okay. First time, let them to cry. Okay. Then you have seen the tears. Okay. Everything you need to act according to your emotional intelligence. Okay. You give tissue. Okay. You have seen that. You have seen the tears. But nowadays it's still social distancing. Patient is sitting there. You are here. Still the social distancing. So therefore, you have to give. Okay. You have to give the tissue actively. Always that. That means you need to verbally tell the patient, would you like to? Okay. Would you like to? Okay, ask the patient, would you like to have some tissue verbally? So patient will do, okay, patient, let's say patient, patient, you verbally say, ask the patient, would you like to take some tissue? Patient will say, thank you, doctor. Let's say patient has taken the tissue and wiping. You patiently wait. This is very rarely they cry, but you need to know how to handle this. Okay, they can cry. You wait. They are still crying. Now you give water. Don't give tissue and water immediately. Okay, not back to back. Tissue is first line, tissue is water is second line. Okay, second line. Okay. So after giving the tissue, they're still crying. Ask the patient, would you like to take some water? Would you like to have some water? Patient will say, okay, thank you. Patient pick up and patient maybe drink. Okay, patient might take it. Patient might drink it. Okay. Now you still patiently wait. They are playing with your patience. You have to just wait. Okay, just wait. Okay, wait. Now, they know that, okay, you wanted to speak to them, but they are checking. But you need to show that I'm cool. Okay, I'm not in a rush. Some students, they rush. This stupid lady is crying. I need to do the management, I read a lot of in the notes. Examiner is looking. Okay, how I am going to do the management? This lady is crying. If you see that you are frustrated and if you are like that, marks will just go. You need to act like, I'm confident, I know how to handle the situation, right? I'm okay with the situation, like, I'm handling the situation. That kind of vibe you need to give. Okay, but they think that you have something different planned. You are not really empathetic to the situation, and you are rushing to talk what you have studied. Then they will try to make it even worse, right? So you play with the emotional intelligence. Now, let's say patient is still crying. You give tissue, you give water, patient is still crying. What are you gonna do? Now ask the patient. Okay, is there anybody I can call for you? You asked this in the first part here. They said no. Because they might not expect this much. Now you can offer that later. Is there anybody? Okay, would you like to call anybody? Is there anybody I can call? Okay, now, these are the things you can do. Just offering support. But now patient will give you signal, right? You can talk. How they can give you signal? Okay, maybe patient was crying like this. They can look up. They can just look up. Okay, and give eye contacts. If they have given you eye contacts and if you are not sure about it, ask them. Is it okay? Ask Mrs. Johnson, is it okay if I can speak to you about what is going to happen next? Can I please explain to you? So, okay, what are we going to do next? Sometimes they can also ask you, so, okay, so what's that mean, doctor? So what are you going to do? They can also, okay, provoke you. You can also start as well. Okay? Right? Start as well. Okay, right. Okay, start as well. Okay, right. Now, okay, so when you are clear that patient is ready and patient is okay to listen, then you tell. Now you need to tell the further news. So far, what you have said, he suffered from a major bleed in his brain. Now you need to tell, unfortunately, his condition is terminal. Okay, sometimes, okay, some of the news comes later. Now they will ask you, what do you mean by terminal? You have to explain what this terminal condition means. Terminal means, unfortunately, he is not going to make it. Okay, they can ask you, what do you mean by he's not going to make it? You can tell, unfortunately, he's not going to recover from this. Okay, he's not going to, okay, he's not going to recover. They can push you and ask you, is he going to die? Is he going to die? If you ask you, is he going to die, first time, okay, tell him, I'm afraid, unfortunately, he's not going to make it. We don't directly say that he is going to die. You try to avoid saying first time, second time. What do you mean by he's not going to make it? Is he going to die? If they keep on asking you again, that means they didn't understand properly. Tell again with the sympathy, I'm afraid to tell you, unfortunately, he's going to die from this condition. I'm afraid to tell you, unfortunately, everything has to come with the unfortunately. I'm afraid to tell you, he's going to die from this condition. Now questions will start. Okay, the last bit of breaking bad news is, okay, the last part, so we did the, okay, we prepare this patient sensitively. That is, preparing the patient means this is these steps. Then, okay, offer the news with the sensitively. That means, okay, sorry. Unfortunately, I'm sorry to tell you. So, unfortunately, I'm sorry to tell you should come before the news. Then, the final part of the management strategy. That's managing, emotional management, clinical management, answering questions, things like that. So, okay, now, okay, you started having a conversation with her. She started asking questions now. Okay, so you can start asking that, like, you know, so have you given up on him? Okay, you said that he's not going to make it, that have you given up on him? If anybody asks you, in any scenario, have you given up on him? Never accept that. Tell, we are not giving up on him. You can tell we don't really give up on our patients. So what do? We try to offer whatever the suitable treatment for them. So what are you going to do for him? So you are going to offer him palliative treatment. They will ask you, what is palliative treatment? If they don't ask, if they keep what, ask them, have you heard about it? No, let me explain to you. Okay, now I'm going to explain to you guys what is palliative. Palliative treatment is a form of supportive treatment. You can tell it is, unfortunately, it's only a supportive treatment. Okay, it is unfortunately a supportive treatment. Okay, tell the aim of the palliative treatment is to make sure, okay, they are not suffering. That means they are not in pain. They are not in distress. Okay, we'll try to offer any suitable treatment in order to improve their quality of life, pain-free, and okay, in order to improve the quality of life and pain-free, and to maintain his dignity. Okay, that is the decent explanation of palliative. Okay, it's a form of supportive treatment. The aim of the treatment to make sure they are not suffering. So we try to treat all the symptoms like pain and distress, or any symptoms that causes distress, in order to improve the quality of life, in order to make sure they are not in pain, and to maintain their dignity. and to maintain their dignity. Maintain their dignity. Okay, dignity. When you talk about this, don't talk about anything else, like IV fluids and things like that, unless the scenario says. Okay, in this scenario, okay, it didn't say anything IV fluids or nothing. Probably nothing for this man. Probably some injections. Okay, so don't talk about anything for IV or anything. Why? The scenario doesn't say. We know he will be given palliative treatment, but we don't know what is going to be in his list. Okay, probably nothing. Probably some subcutaneous injection. Okay, there are different palliative. Okay, different patients are treated differently. Generally, guys, write it down. If they're given you a palliative in the scenario, okay, generally, okay, in the scenario, okay, in that situation, you can talk, this is what we're going to do. If they don't give you anything, generally it's nothing. Okay, no invasive. Right, good. So when you talk about palliative, they will ask you about aggressive invasive treatment. Everywhere has the same structure. So why don't you do an operation for him? Okay, why don't you do an operation? Or why don't you, okay, take him to ICU and treat? Can't you treat him in the ICU? Okay, why don't you do an operation? If they ask you, tell we are not going to do any operation. Okay, we are not into intensive care unit. Why? Okay, why? Because any of the treatment given in the ICU or ITU, okay, intensive therapeutic unit. Okay, intensive therapeutic unit. So intensive therapeutic unit, okay, will not help him. Okay, will not help him. Okay, any of the treatment will not help him. It will not be beneficial for him. Okay, rather it can be, okay, more distressing. Okay. 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 So distressing for them. Okay. So why we are not any of the invasive treatment will not be beneficial. Okay, either surgery or intensive care unit treatment will not be beneficial. Rather, any of this invasive treatment can cause more distress. Okay, so they have to go through this. Okay, they have to go through this. Okay, without having any benefits. Without having any benefits. Right? So without having any benefits. So the decision was made based on his best interest. Okay. Why we are not doing anything? Because he's not going to be benefit from this treatment. Okay. Benefit from this treatment. Okay. So when you talk about this, then She's going to ask you, so how long will he live? How long will he live? Okay? You cannot tell that, okay, we don't know. Why? Generally, general public expect doctors to give some time frame. So you need to tell that. Okay, you need to tell that. You can tell. Unfortunately, it's difficult to say exactly how long he might live. But you need to give rough idea. Unfortunately, this could be, okay, within the next few hours, or within the next few days. Okay, it could be within the next few hours or next few days. They can ask you now, can I take him home? Okay, if they ask you, can I take him? Answer is, it's better to say no. And explain why. Okay, but okay, refuse it in a nice way. Okay, explain it is better for him to be in the hospital. Okay, hospital is the best place for him at this stage. Why? Because we have to offer him palliative treatment. Okay, the best place for offer a palliative treatment in hospital. But ask the patient, like, can I ask you why? Can I ask you why you want to take him home? Why we need to ask is, because sometimes if Mr. Muhammad Ali had ever had any wish that he wanted to die in his home country, okay, he wanted to die in Pakistan, the village that he was born in. You have to let them to do that. So you need to always ask, may I know why you want to take him home? You need to just simply check whether, if she says, like, for example, because my father wanted to die in his own house, for example, okay, on village, I mean, his village, for example, then you have to escalate to the seniors. You'd have that idea, but in that case, I'll speak to my seniors regarding this, but they are not going to tell. But you need to always ask why and give your suggestion. It's better for him to stay in the hospital. The last question they can ask you in this one, why did this happen to him? Why? What is the reason for this? So the reason is explained in the task. So explain. The surgeons believe that. Okay, if you have a very limited time, you have your timing. If you feel like the time to be finished, quickly answer. Okay, the doctors believe he had a bursting of the blood vessels in the brain. Okay, basically it's a burst of blood vessels in the brain. Okay, burst of blood vessels in the brain. It's a burst of blood vessels in the brain. Okay, burst of blood vessels in the brain. Okay, if you have a lot of time, you can tell the surgeons believe that he had a condition called peri-aneurysm. That means he had some malformed and swelling of the blood vessels. Due to high blood pressure, okay, they have burst and caused the bleeding. Okay. So you know that you can explain according to how much time you have. Right? It's clear? Right, clear. So this is the scenario. The scenario, okay, yeah. It's the basic scenario, and we learned all the steps here. Okay, right? So the scenario has got a lot of variation. Okay, we talked about speaking to wife, right? And the first scenario, she was sitting and calm, and you're going to speak and talk. Okay, variation 2. Variation 2, you're entering into the room. You spoke to the examiner. I mean, examiner will reach you when you go there. Okay, examiner will reach you. Okay. Okay, so examiner will reach you, and after that, examiner will tell you start. When the examiner says start. When the examiner says start. Okay, when you turn, okay, she will jump on you and ask, how is he, doctor? Okay, oh, how is Mr. Muhammad Ali, doctor? Okay, how is she, doctor? And how is Mr. Muhammad Ali, doctor? Okay, they can ask you like this. Okay, how is she, doctor? Or how is, okay, how is Mr. Muhammad Ali, doctor? Like that. Okay, you are just turning and asking, hello. He's asking, how is he, doctor? How is Mr. Muhammad Ali? You haven't done any identity check. You haven't confirmed the names, relationship, nothing. Okay, they might ask you something like this. Okay, how is he, doctor? How is Mr. Muhammad Ali, doctor? Like that. If somebody comes and asks you like that, first you need to check the identity. Okay, the reason they do like this, in the hospitals, a lot of time this happens, without checking the identity, they give wrong information to wrong people. Okay, right? Right. So, if there's somebody comes and tells you, first thing you need to say, I'm so sorry. Okay, first thing, okay, you need to say, I'm so sorry. Oh, I beg your pardon. Okay. Then let's say you haven't, okay, okay. You haven't done anything, so you need to say, I'm so sorry. Chal, can I please check some details before we discuss further? Can I please check some details before we discuss further? Okay, please let me introduce myself. Okay, please let me introduce myself. I'm Dr. Lovan. I'm one of the doctors. Okay, I'm Dr. Lovan, one of the doctors. May I know your name, please? They understand you are related to Mr. Muhammad Ali. How are you related to him? Okay, if she asks you, okay, I'll tell you the within that another version. Okay, when you say hello, okay, she's asking, okay, how is my husband, doctor? So I need to tell, I'm so sorry, can I check some details before we further discuss? Let me introduce myself. Okay, I'm Dr. Lovan, I'm one of the doctors. May I know your name, please? Okay, my name is this Alina. Right. So you mentioned to me about your husband. You mentioned to me about your husband. So may I know your husband's name as well? Okay, he's going to Mr. Muhammad Ali. Okay, thank you. So Mr. Muhammad Ali is your husband. Okay. Then after that, you need to, okay, after you finishing the identity, you will have to tell a vague answer. You need to give an answer before you go further. So, okay, you did ask about Mr. Muhammad Ali. Tell, unfortunately, he's not doing very well at the moment. But I'm afraid, unfortunately, he's not doing very well at the moment. Okay, you need to give a vague answer. Then I understand he has been brought by an ambulance today. Would you like to tell us what happened? Okay, you must have got all the sketch of this. Okay, when you practice and apply this. Okay, good. Okay, then the remaining is the same. Right, wife, we are speaking to wife so far, right? Wife can come inside the room or she can be over the phone. Whatever the situation, she knew what happened. So you don't have a problem. Now we have a son. Okay, son is inside the room. If son is inside the room, he knows everything. What happened, everything he knows. Okay, everything he knows. So it is similar to the wife. But there will be a problem if the son, not problem, it's different. If the son is over the phone. Okay, sorry it comes like this, but okay, speak to the son, Hassan Ali, over the phone. Whose son is a Hassan Ali. over the phone. Okay, if it's over the phone, he doesn't know that father is in the hospital. That is why it's different. So, okay, if it is son over the phone, you're going to the telephone approach. Okay, if it is a son over the phone, what you're going to say? Okay, hello, hello. Okay. Right? Then, may I speak? Can I speak to Hassan Ali, please? Speaking. Okay, Hassan Ali. So, can I speak to? Okay, can I speak to? Okay, can I speak to? Okay, can I speak to Hassan Ali, please? Okay. Okay, speaking. Then introduce yourself. Hassan Ali, I'm Dr. Lovan, one of the doctors. I'm calling from the Manchester hospital. Tell the purpose of the call. We have in Hassan that we can ask, can I call you Hassan? You can ask the first name here and the first two steps. So Hassan, we have been told that you are related to Mr. Muhammad Ali. Am I right? Am I correct? What is your relationship? Okay, is he your father? Yes. Right? So tell the purpose of the call, okay? The reason I'm calling you today, okay, Hassan, that we have been told, okay, that Mr. Muhammad Ali is your father. Is correct. Or you are related to, not your father, you are related to, sorry. We have been told that you are related to, or close related to Mr. Muhammad Ali. Okay, am I correct with that information? Yeah, he's going to say, yeah, he's my father. Right. So, there is something that I've been asked to talk to you. Can I talk to you right now? Get the consent. There is something, don't tell what it is, you don't have to go into detail. There is something that I've been asked to talk to you about your father. Can I talk? Do you have a minute? Okay, are you in a rush? Are you in the middle of something? No, Dr. Fine, you can talk to me. So before I go into detail about everything, I just wanted to make sure that I have the right information with me. I have the right papers with me. Therefore, I would like to check some details to make sure myself I'm correct. Okay, to make sure myself. So can you please confirm your father's date of birth for me? And his first line of your address, his address, please. Thank you. Okay, if they give you two information, check. Once you finish this introduction, okay, introduction is clear and plain and smooth. Now you start. So actually, the reason I'm calling you today, because at the moment, your father has been brought in to the hospital. Your father was brought in this morning to the hospital. Ask, did you hear this news? Are you aware of this? Ask, do you know whether your father is in the hospital? He's going to tell you, no, I don't know about it. Is he in the hospital? What happened to him? So he doesn't know father is in the hospital. Therefore, you cannot take incident history. Can you know? So move to the next step, risk factor. So ask like this. So has he been recently? Sorry. Has he been recently unwell? Was he unwell today? I mean, not today, recently, because he doesn't know about today. Recently. Okay. Have you seen him recently? Was he unwell? Whether he has any long-term medical conditions? Ask like the previous one, risk factor. When you take this history, sometime the son can become more anxious. He may act like, I'm so anxious, like, doctor, what happened to my father? Is he okay? Okay, that kind of anxiety usually they show only in this one. I'm worried about doctor. Is he okay, doctor? If you sense that son is getting more worried and angry, anxious, and he's not ready, okay, he's not going to have a proper conversation or something like that, you understand? You might feel like you have been pushed. The son is pushing you. If you felt like that, leave this and jump into invitation. Otherwise, you go smoothly with this. Okay, but if you felt like he's pushing me and he's showing that he's anxious, if when he pushes toward the message this side, don't push him back. Like, I'll come back to it, I'll come back to it. Don't do that. Okay, don't do that. Okay, do not do that. Okay, you go back to invitation. Okay? If that happens, you go back to invitation. How are you going to invite? Tell, here it's not an update. Why? Update you give if they have some information. That's why when you choose a phrase, you need to think and choose. Tell there is something important. Tell there is something very important that I have been asked to talk to you. Invite him to come to hospital. Like, would you like to come to the hospital? Or is it okay if we can discuss over the phone? Okay, okay, ask, where are you at the moment? Where are you at the moment? Okay, where are you at the moment? Okay, where are you at the moment? Okay, where are you at the moment? Are you at home? Ask, is there anybody around, okay, in the house? But you don't need to tell him to bring everybody near to the telephone. But you check whether he's alone at home or somebody there. Are you alone at home? Don't ask, are you alone? Ask the patient, okay, is there anybody at home? Are you on your own? Where are you? Okay, you need to know that whether he's in the garden or he's in the street, you need to know. Right? Then, okay, you know how to invite that. Okay, right. Then, ask the patient, would you like to come to hospital for further discussion? Or is it okay if we can discuss over the phone? Then you go to narrative. Okay, narrative. Okay. Narrative is not as we understand. Usually narrative is as we understand. Yeah, as I mentioned to you. Okay, or as we discussed. Okay, unfortunately, your father collapsed. He collapsed at home this morning. This morning, okay, he collapsed. Then he was by ambulance. The remaining is the same. Okay, palliative, everything is same. He will ask you questions. Okay, right. Then there's the last one in this. Is they will put an English name. English version. Okay, emergency department. They might put some, okay, David Johnson. Everything is same. Rather than giving terminal here, but the same as sort of bleeding. Rather than giving terminal, okay, they might give you, he will not tell, they will, okay, they will write that the doctors believe that he will not survive this admission. What they have written, he will not survive this admission. That is what written. If it is written, he will not survive this admission, you cannot go and tell he will not survive this admission. That is not very pleasant thing. How can you tell he will not survive this admission? Sometimes they put this sort of words to play around. How are you going to change it? Okay, he will not survive this admission, you can talk to your colleagues. They have written away that, okay, that you discuss with the colleague. You cannot tell the same phrase for family. So need to tell, unfortunately, I'm sorry to tell you, he's not going to make it. Okay, don't use the word or the phrase, he will not survive this admission. Okay, otherwise everything is same, it's going to be palliative. Okay, he will not survive means terminal. Terminal means treatment is palliative. Okay, right? Right. That is all Mr. Muhammad Ali related stuff. Okay, right. There are two other scenarios, guys. I will advise you to read it on your own, okay? But I will decently, clearly taught you breaking bad news approach. okay, with the help of that approach, okay, you can simply, okay, study. There are two more related to. One is bilateral stroke, other one is Mohammed-Khan, SARS-Khan scenario. All of them are related to the same palliative. Okay, right? It's the same concept. Only thing, okay, just look at into the history part. The next one is breast cancer. Cancer related. Okay. You are left to in the GP. You are left to in the GP. Your patient is a 50-year-old lady. This lady, she has come for the breast biopsy done. Okay, she has a breast biopsy done. She has come for test results today. The scenario says the surgical department has asked you to discuss the biopsy results with the patient. It's an important point. Why it is important? Because you need to know why are we discussing the biopsy. Biopsy is done by surgery, breast unit. Okay, usually interventional radiology, but okay, or okay, yeah, mainly. Okay, biopsy has been done. Okay, so biopsy is done now. Okay, but it's a surgical team that arrange. So why are we discussing in the GP? Because they made it at little changes during pandemic. Okay, during pandemic, what they did is they made most of the scenarios to happen. Okay, they made it to happen in the GP. Okay, in the GP. Okay. So, GP setup. Because they reduced the number of patients going to the hospital. So they made it scenarios like that in that situation. Then they left it like this. Still, it is in the GP now. Why we need to know this? Because the management matters. Okay, this information matters for management. Okay, it's important. Right, other information. She had a routine mammography. So basically, this lady had a mammography. Okay, the lady had a mammography. Okay, why they had a mammography, we'll come to know that because she came for well-woman clinic. What is well-woman clinic? Anybody above 40, okay, every 4 to 5 years, okay, use some places 4 years, 5 years, they have a routine checkup. Well, they have a fancy name for that. Okay, well-man clinic, well-woman clinic. You know, so okay, there are some national screening. Okay, so according to that, okay, they will have some testing. Okay, like doing PSA, colonoscopy, things like that, you know. R6 by doing AAA scanning and things like that. Right, so well-man, well-woman clinic. So she came for well-woman clinic, then she's 50. So after 50 years, every 3 years we have a mammogram. After 50 in the UK, every 3 years mammogram, screening mammogram. So she had a mammogram. The mammogram showed suspicious changes. Okay, the mammogram showed suspicious changes. Okay, suspicious changes. Okay, and she was asked to have a biopsy. The biopsy shows an intraductal carcinoma in situ. Intraductal carcinoma in situ. And it is a very early stage of breast cancer. Very early stage of breast cancer. Okay. Why did they give intraductal carcinoma in situ? Why did they give this? Intraductal carcinoma in situ. Okay, why did they do this? Because they put a medical term. They also mention very early stage of breast cancer. Why? To trigger you. Okay, most of the people will tempt to say, don't worry, it's early stage of breast cancer. Okay, especially foreign doctors, they like to give false hope, like don't worry, don't worry. This might work back home. It will not work in the United Kingdom because, okay, you may cause problem for the trust. Okay, if you give some false hope like this. Okay, you have to tell the truth clearly. Right. So in order to trigger you, they left it. Okay, because some people come with this like, I have a good news and bad news. Okay, good news is okay. There's no good news and bad news come together. When there's a good news and there's bad news, always this bad news will supersede the good news. Okay, there's nothing called good news and bad news. Okay, right? There's no place for good news when there is bad news. Okay, in Plato, nowhere you will say good news. Except two places, but I will tell you which ones. Right, now what you must do, explain the results. Explain the results to the patient, discuss the treatment options with the patient. Okay, they are interested in treatment options too, and address the concerns. Okay, right, background information, as I tell you, she came for well-woman clinic, she never had symptoms. Okay, and she regularly do breast examination. That's it, there is nothing in the history. What is the first step? Read and paraphrase. Okay, paraphrase, understand you have come for the test results today. Right, anyone come for any scenario, any test results, you need to ask these two questions. Write down these things, you will forget. Okay, do you know what tests were done? And may I know why you have done this test? Okay, do you know what tests were done? And, okay, do you know what tests were done? And, okay, and do you know why these tests were done? Okay, do you know what tests were done? And may you know why these tests were done? Okay, right. She's going to tell you about the story. Okay, I came for well-woman clinic, then asked to do a mammogram. Okay, they saw something suspicious, then I did a biopsy. Okay, apart from that, now you do this. Here, no incident, no prior knowledge, rather you are going to ask about symptoms. So have you ever had any symptoms? That is open-ended question. Have you had any symptoms? Asking open-ended question, then followed by closed-ended questions. Okay, a mixture of open-ended question and closed-ended question. Do you know what domain is going to give you marks? You don't know? Okay, read. Okay, domain 3, interpersonal skills. Okay, interpersonal skills. Do you know what is interpersonal skills cover? People think interpersonal means being nice. You are a nice husband, you are a nice father, nice mother, okay, beautiful, okay, rock, I don't know. Okay, that is not interpersonal. Okay, listen to this. Okay, interpersonal covers how the candidate approached the patient. That's why I was talking about introduction, okay, paraphrase, or okay, non-paraphrasing. Okay, how you approach is important. Okay, then where they establish the rapport with the patient. That's why I talked about the rapport. Okay, the 3 E's. Now, okay, you build the rapport, now you open that question. Open your mouth, sorry. How they use open and closed-ended questions. So using open-ended question and closed-ended question is interpersonal. Okay, you need to know that 50% of your English, your speaking part is interpersonal. Okay, there are some other parts also remaining. Whenever necessary, I will talk about that. Okay, so I was talking about, okay, using closed-ended question and open-ended questions. Okay, open-ended question is asking, have you had any symptoms at all? Closed-ended question, have you had X, have you had Y, have you had P, have you had Q, like that. Okay, right, good. So, okay, that. Now, so ask about the symptoms. Have you had any symptoms at all? No. Ask some symptoms closely. Like, have you ever felt any breast lump? Felt any breast lump? Okay, have you ever had any breast lump? And, okay, have you had any changes on the skin of your breast. Okay, any any dimpling of the skin, any color changes on the skin, right? Ask about the nipple changes. There are 4 nipple changes you can ask in terms of nipple. Okay, nipple changes. Okay, number 1, any changes of the shape of the nipple, maybe growing inwards, size of the nipple, color changes of the nipple. Okay, color changes of the nipple. Okay, then what else? Okay, then size and the shape and the color and any fluid leaking. Okay, any leaking of your fluid, leaking, any fluid leaking, blood, stain. Ask about any pain in your breast, any tingling, numbness, itching. Have you experienced any of this? Okay. Have you experienced any of this? Okay. Symptoms. Okay. Secondary symptoms now, after primary symptoms. Any lumps anywhere else in your armpit, on your collarbone, any weight loss. Okay, any weight loss, any pain in your body. Symptoms. Risk factor. Okay, risk factor. Think about after some medical related risk. Ask, have you had any previous breast conditions? Okay, previous breast conditions. Have you had any like previous lump, any polyps? Okay, any lumps, any polyps? Okay, previous breast, any treatment for breast conditions? Medication. What medication? Only 2 medications causes breast cancer. Ask any hormonal treatment, contraceptive pills. Next one is family. Anyone in the family, I'm sorry to ask about this. Anyone in the family had any breast cancer, any ovarian cancer, any other cancer? Okay. Then there are a little bit of a social history, like ask about children, priority, null priority, late priority. So what age you had your first child? Okay, breastfeeding. Non-breastfeeding is a risk factor. Okay, then after that. Okay. Then after that, what else? Okay, after that, okay, after that, uh, um, mm, uh, period. Okay, ask about the first period. Ask whether she still have a period. Okay, I think she stopped period like 1. Okay, she's having menopause now 1 year. Okay, right. Okay, right, good. Then what else? Okay, that's it. You can ask smoking if you want. Okay, a little bit. That's it. Okay, don't ask for diet and exercise. It's not, okay, if you ask about this, okay, diet and exercise. I hate diet and exercise and pap smear and PEEP. Okay, yeah. Pap smear, you might sound like somebody has taught you, somebody has asked you to ask you, but you don't understand why. You might sound like this, okay? So therefore, sometimes you need to leave things. Okay, if you are going to lose for not asking about diet, let's lose it. How much are you going to lose it? Better not to, okay, because that will spoil your beauty. Okay, the quality of your performance, quality of your thinking. Okay, what is important, the quality of your thinking. Okay, right, good. So sometimes, okay, leave things. Some people have OCD. They wanted to ask everything everywhere. Then that become a kind of poor quality. Okay, right, good. Now good. Now, okay, now, then after that, socialist, rather socialist, you can ask socialist. But can ask generally, like, any medical problems and who do you live with? Okay, any other medical problem you can ask. Okay, right. That is for the future treatment. You can ask any medical problem, any medications. But who do you live with is important. Okay, my husband. How is your relationship with your husband? Is he supportive? You need to have a supportive partner. She's going to go for cancer treatment. What do you do for living? Are you still in employment? Okay, that is quite important. Okay, because he has to have work and it's treatment and all. It's a lot of stuff, right? So once you finish that, okay, then you need to ask idea a little bit. Why? Idea you ask for the particular person who is going through. You don't ask relatives. So ask the patient, what are you going to ask? Ask about the idea about the biopsy results. So what do you think? Ask, what do you think, in your opinion? What could this biopsy result show? What could show this biopsy results? In your opinion, what do you think? Okay, in your opinion, what do you think? What could this biopsy result show? Okay, in your opinion. Okay, what could be the biopsy results? Okay, in your opinion. Okay, ask, when they're taking the biopsy, did anyone tell you what were they looking for? Or anyone mentioned to you, what could this be, could be? She has some idea. She will tell you, they told me, this could be nothing. Or maybe early stages of cancer. So she has some idea. It's not going to be everything completely new to her. Okay, once you finish this one, go to the invitation. So be careful in terms of invitation. It's not update. Okay, tell obvious, I understand that you have come for the biopsy results today. But double check, but I would like to double check with you. I would like to know whether are you okay to discuss it today? You need to ask the patient, are you okay to go ahead? Why? Sometimes patient can say, not today. Patient can tell you, not today, doctor. Why? Because, I don't want to, okay, I don't want it today. Okay, why? Because, okay, let's say patient says, doctor, my daughter's wedding is next week. Okay, I don't want to ruin her wedding. Okay, can we discuss after my next week? Like, that is not the case, but I wanted you to think. Okay, think. If the patient asks in that situation, okay, you have to postpone it. When the patient doesn't want to know, you cannot force them to know. That is also autonomy. They have the autonomy to know, they have the autonomy to not to know. Right? Think about it. So ask the patient, is it okay to discuss it today? Is it okay? Okay, I understand you have come for the biopsy results. I wanted to check this with you, whether are you okay to go ahead? Are you on your own? Would you like to call anybody? Some people sometimes they prefer to be with some family members. Would you like to call anybody before we discuss? You also know that, guys, okay, this sort of talk it's a kind of warning shot. Once you finish, patient not going to until there's nobody. Okay. My husband is at work, there's nobody, okay. You go to the narrative part. So as we understand. Okay, as we understand, you tell her story. So what a story? What is the things in chronological order? So initially you came for well woman clinic because probably because of the age they asked to do a mammography. Following mammography, unfortunately they saw something suspicious. After that, you have been given advice to take a biopsy, and here we are today with your biopsy results. Am I correct? Yes. Shall we receive the biopsy results? But I'm afraid, give a warning shot, I'm afraid, unfortunately, we don't have a very good news regarding your biopsy results. If you say this one, that is going to cause a lot of anxiety. Therefore, don't delay the news. Don't talk something after that. If you say, I'm afraid, Mr. Johnson, unfortunately, I don't have a very good news regarding your biopsy results. If you say this one, tell that immediately. I'm sorry to tell you. The sorry has to come before. Don't say, okay, some people say the news, then they say, I'm sorry about it. Like slapping and saying sorry. No. Okay, you need to say that, sorry I am slapping. Okay, that is the right way. Okay, I'm sorry to tell you, unfortunately. Okay, I'm sorry to tell you, unfortunately. Okay, unfortunately, the biopsy result shows that you have an early stages of breast cancer. The biopsy result shows that you have an early stages of breast cancer. And pause it. Wait. Look. Okay, these days they don't cry. Patient can shy. Oh, like this. Oh my God, like this. Okay. You see, the patient is reacting like, you can tell, I'm so sorry, Mrs. Johnson, I had to discuss this with you. I'm really sorry that, I'm really sorry, Mrs. Johnson, this may not be some big deal. I'm really sorry. Okay, you see, okay, what's happening? She will ask you, so what's going to happen now? Okay, what's going to happen, right? So what is not going to happen in terms of management? Okay, guys, in this scenario, okay, I want to tell you three things. I forgot. Okay, write it down somewhere in the corner. Number one, you must know the name of this. Okay, don't go and ask the patient, may I know your name, please? Okay, that is not very nice. Why you are preparing to tell her important information to a patient? Why you don't know her name? So you know the name. You should know the name and ask the patient, are you Taylor? I've been waiting for Emma Taylor. Okay, because you know that Emma Taylor is going to come today and I'm going to tell cancer. It is a big day for you. Okay? It is a big day for her. In that situation, if you go and do like this, can you confirm your name and age, please? Then you are the worst one today. You are the worst doctor to meet, okay, for her today. Okay, you are like this, okay. Others, okay, the one, the front and the back will do very well. You are the one, okay, can you confirm your name and age, please? Others are you Emma Taylor? So Emma Taylor, can you confirm your age for me, please? Thank you. Can I call you Emma? So Emma, I understand this, so they will do very well. That is the first thing. Second thing, don't do physical examination. Like, I would like to examine. This is a proper, clear, typical Breaking Bad news. Okay, what are you going to do with the examination? If you try to do examination, that means they will realize that you didn't understand this is a different type of test. For you is everywhere same. Okay, and also you will spoil the beauty, you will break flow. So never ever do examination for this. Okay, never go an examination. Okay, now if you are going to lose 40 marks, okay, let's lose it. Right. The last thing is, when it comes to management, it's not 2 weeks different. Okay, don't do 2 weeks different. Okay, it's not 2 weeks different. 2 weeks cancer pathway, 2 weeks wait is when you suspect a cancer. Here you have a biopsy results. When you have a biopsy results, what are 2 weeks different? It's not a 2 weeks different. Okay. Okay, you see it here. This is the cancer pathway referral. Okay. So when a GP suspect, okay, because in the initial GP appointment, if the GP suspect, then you use a 2 weeks pathway for the first seen by the specialist. Okay. Now this patient is in this stage. There is a diagnosis, the decision to treat. Okay, this patient is in this, okay, the second point here. Okay, the next step for this lady, they will start the treatment. So what is going to happen to her? You will receive a letter for them to, okay, discuss with you about the treatment. Your treatment will be started within 1 month. Okay, the specialist team will call you to discuss the treatment options, and they will start the treatment. To come to an agreement, a plan. Okay, what sort of treatment to offer? Okay, so the next thing you will receive a letter, okay, for the specialist appointment to discuss within next few days. Okay, and the next thing is your first treatment will be started within 1 month. Within 1 month. Okay, the first treatment, okay, will be started within 1 month. Okay, so 1 month. Okay, right. Right. Right, within 1 month. Okay. In terms of your treatment, she will ask you, okay, what are the treatment options then? Okay, so in terms of treatment options, okay, surgery is the main treatment. Okay, surgery. Surgical, okay, is the main treatment, surgery. There are 2 types of surgery. One, okay, they can, okay, remove the part of your breast, tumor, and some surrounding tissue. And it's called breast conserving surgery. An area of the breast can be removed, or they have to remove the whole breast. Removing the whole breast is called mastectomy. There are 2 options. Okay, so in terms of the options, okay, the surgeons will talk to you. After the talk, okay, they have, okay, after they are, okay, discussing with you, either they can recommend to do a particular type of treatment, or they can give you an option to choose it. Okay, choose the operation. They can tell you an option, either this or that, you can choose it. Or they will recommend it's better for you to do this. Okay. Right? Right. Then, okay, then after that, in terms of treatment, if you have a mastectomy, okay, if they had a mastectomy, they also remove some of the lymph nodes. Okay, which is some of the glands in the armpit. That's called sentinel, okay, lymph biopsy. Okay, then if you have a mastectomy, you can also have a breast reconstruction. That means a new breast made. Maybe during the treatment, or sometimes after the treatment. Sometimes after the treatment. Either during the treatment, after the treatment. Okay, so that is all about, okay, that is mastectomy. Following the mastectomy, sometimes you might have a chemotherapy or radiotherapy with that. Okay, right. Or they can also offer surgery and hormone therapy. Surgery and hormone therapy. Okay, hormonal therapy. So after the surgery, some people, they prefer to offer, following hormone therapy, surgery, hormone therapy. If they were to give a hormone therapy, that is for 5 years. Okay, in order to receive the hormone therapy, first thing, you should not have any radiotherapy. Okay, if you had any radiotherapy, they cannot offer hormonal therapy. Second thing, you also need to be suitable for it. That is about receptors. You don't need to tell the receptors, patient will not understand. They will check whether you are suitable for it. Okay, from the tissue biopsy, they will understand whether you are suitable for hormonal therapy, then they will offer hormonal therapy. Okay, right. These are the treatments, right? When you talk about this, now what she might do, she might try to blame herself. You know, after the breaking bad news, you have heard about it. Patients can show different emotions. Number one, they can be really sad and cry. Okay, that's happens. Some of the scenarios can happen. They can have a denial. Okay, they can get angry, or they can have a guilty feeling. Okay, here they have guilty. She might feel a little guilty. You need to pick it up. Okay, you need to know that this is what's going on. She might try to blame herself. Doctor, how come? How did I miss this? Doctor, always I examine myself. I always examine myself. Okay? I always examine myself. Okay, how can you miss this? How can I miss this? Okay, I do self-breast examination. How did I miss this? Like that, okay? So how bad I am like that? You don't need to blame yourself. It is not your fault. The report says it is a very early stage of cancer. Okay, the report says that it is a very early stage of cancer. So if it's a very early stage of cancer, you may be not able to. Okay, if it's very early stage of cancer, you may be not able to tell. Okay, early stage of cancer, they don't develop any lump, so you don't need to blame yourself. It may be not your fault. Okay, this may not be your fault. Okay, this may be not your fault. You don't need to blame yourself. Okay, you don't need to blame yourself. This may be not your fault. Okay, so okay, tell the patient the report says early stage of cancer. Okay, right, good. Right. You can, okay, you have, at some point, you guys, when you discuss, you can mention the name later. After discussing the tests, well, the report says intraductal carcinoma in situ. Okay, intraductal carcinoma in situ means it's an early stage of cancer. But don't give any good news. Okay, no need of giving good news. Okay, you're not going to gain anything. You're more likely to lose something. Okay, if you give unnecessary good news. Right, that is about breast cancer. Okay, right. Right, next one. Okay, that what we are going to discuss is dementia. Okay, dementia. I'm sorry about the handwriting. The fonts are a bit smaller. Okay, dementia. So in terms of dementia, okay, in terms of dementia scenario, okay, so dementia. So dementia scenario, let's read the scenario first. Okay, dementia scenario is, right, so yeah, I have two in the medical unit. Okay, and you have a patient who is a 78-year-old lady. She has been admitted to the hospital due to weight loss. The reason for that admission is weight loss. Other information. This lady, okay, she has been suffering dementia for 3 years. And she stopped taking food for the last 4 weeks. Like not eating anything. All the investigations, including blood test, ECG, X-ray, ultrasound, all of them are normal. All of them are normal. The nurse have given her a sip of water and she tolerated to take it. Every single sentence has got some meaning. Okay, when they talk about the investigations, normal means medically no reason. Okay, okay. She is taking some fluids through the mouth. That means there is some oral intake. Now she's very weak, but she's medically managed. This lady is medically managed. Okay, medically managed. The palliative care has been decided by the consultant. Okay, here they give, okay, palliative. So you are going to tell terminal. It has been decided there's no further invasive or aggressive treatment. They decided to not to offer. Okay, you don't need to go and tell this, but they will ask you. Okay, all the time when you have palliative cases, You need to only talk about what you are going to offer rather than what you are not going to offer. Okay, right? Right. So then, right? So the patient is not available to talk. Okay, please talk to the daughter. Okay, Emma White. And what you need to do, take a relevant history. Okay, take a relevant history. Explain her mother's health status. Okay, look at the task. Take a relevant history. Explain the mother's health status. Okay, health status. Okay, and discuss the further management. Discuss, okay, further management plan. Address the concern. Okay, right. So explain, take a history, number one. Explain the health status. Discuss the management. Weight loss is, okay, due to dementia. Okay, weight loss is, okay, due to dementia, right? So before we start this, okay, we need to learn about, okay, two more things. Okay, before we go into the task, okay. Number one, okay, we need to learn how to take a social history for the elderly person. Elderly person. Elderly, somebody is dependent, okay, yeah, social history. Social history for this elderly people has got three elements. Number one, their living condition. Number two, about their mobility. Number three, their independency. Okay. Okay. So first one is living condition. Okay. This is something else, not related to that. Okay. General thing. There are some general elements sometimes I teach. Okay. So elderly history, elderly person social history. Okay. Elderly person social history. Okay. Elderly person social history is. First one is living condition. So if it is a patient, you can ask, who do you live with? Where do you live? Or if you're asking the daughter, where does she live? She can live their own house. Okay, where does she live means, like, it's not like you're checking whether she's living in the under the tree or house. No, you are checking what sort of establishment. Whether they live in their own house or they live in institutions. Okay, they can live in institutions. Okay, so they live with a family. Very rarely they will live with a family. Okay, right. They live, but very rare. Usually, okay, I live in my own house. I live with my daughter. I live in a care home, nursing home, things like that. If somebody, okay, right. If they are living in their own house, okay, if it is related to orthopedics, okay, if it is related to orthopedics, okay, you need to ask what sort of housing is that. Okay, the usual UK housing is 2-story. You have a ground floor and upstairs. Ground floor, what you have kitchen and the living room. Upstairs, you have usually 2-bedroom and a bathroom. That is a normal setup. But, okay, so there is upstairs, downstairs, you have a staircases. Okay, yeah. Okay, right? This attached bathroom setup is the other country idea. UK, okay, they don't have this. Okay, maybe the new houses they may build, but the normal housing is not like this. Okay, having an attached bathroom. Why attach? Go to the toilet. Right. Now anyway. Okay, but elderly people, when they have a problem with the mobility, they tend to have a sort of housing called bungalow house. Bungalow. Okay, this term came from Bangladesh, okay, Bengal, that area. Okay, right, so that is the Indian term. That means everything on the floor. The housing is, okay, there's no upstairs. Kitchen, bathroom, toilet, and everything, okay, it's on the floor, living room. So what sort of housing is that? If it's an elderly person, which you say this is a type of bungalow house. Okay, 2-story building. Is there any staircases? How many staircases? How are you finding climbing staircases like that? Okay, ask. Then, do you have any carer? Do you get any carer support? Okay, that is living condition. Who do you live with? Second is mobility. How is your mobility? Do you move around? Okay, do you have a problem walking around? Okay, do you use any Zimmer frame? Any crutches? Do you have any problem with walking? Any joint pain? Balance problems? Do you use wheelchair? Are you wheelchair bound? Okay, right. Third one is independency. Are you independent in terms of doing your day-to-day activities? Are you independent? Are you independent in terms of doing day-to-day activities? Okay, are you independent in terms of doing day-to-day activities? Okay, what sort of activities that you can do yourself? What sort of activities that you need help with? Okay, ask some of the examples, like what about changing your clothes and eating and going to toilet? Do you need help with those activities? Do you have any carer? If they have a carer, how often do they come and help? Or what sort of activities that you need help with? Okay, right, good. This is elderly person social history. Okay, this part is important. Okay, right. So it depends on the scenario. Okay, whenever you deal with the elderly people, if you think that it's relevant, whenever you take a history anywhere, whenever you ask something in the history, you need to think, you need to analyze this, whether you might need this. Okay, you might need this either to make a diagnosis or for the management. Okay, otherwise don't ask anything. Otherwise it's going to be irrelevant. Okay, every question you need to ask a recent thinking. The examiner should figure it out why she or he is asking this question. They couldn't figure it out, then you are irrelevant. Okay, good, right. So that is a little about the social history. Okay, okay. So let's do this scenario. Okay, this scenario background. Okay, this scenario background is basically, okay, the mother lives with the daughter. Okay, daughter is the only carer. The last 3 years she has dementia, but she has been losing weight. But the last 4 weeks she stopped eating at all. So daughter brought the mother to admit for this reason. What reason? Not for because of dementia. Because she's losing weight and not eating. Okay, that is the background. But they have given you this task and they said, okay, palliative. Consultant, okay, is decided palliative. That means they have given you, okay, the treatment plan. So you need to tell the diagnosis terminal. Okay, vice versa. Okay, the point that her condition is terminal is hidden. Okay, in the Muhammad Ali scenario, the other way around. They said his condition is terminal, so you're going to tell, okay, his treatment is palliative. Okay, right? It's very simple. Right. Here, even though, okay, you're going to tell a pregnant, okay, bad news. Yes, you're going to tell her his condition is terminal. That is the bad news. But we don't use our pregnant bad news approach. Okay, we have a dementia approach. So I'll tell you what you need to do as a dementia approach. For the history taking, you have 4 elements. History. Number 1, okay, this starts with the weight loss. Right, so number 1, explore about the weight loss and mother's eating habit. Number 1. Number 2, ask about dementia. But mainly ask how the dementia has changed mother's life. Number 3, social history of the mother. Number 4, social history of the daughter. Why we need to ask daughter social history? Because she committed to look after the mother. We need to check whether she can do the job. Okay, we are not asking, can you please look after your mother? No. Okay, in the Western countries, elderly care and children, they are responsibility of the state. That's why we pay this much of so much tax, because they have got a very good welfare system. Okay, no one is dependent on anybody. You don't need to. Okay, the state will look after them. Okay, state will look after them. Okay, right. Now, okay, now, okay, right. So the thing is, you need to understand what we are doing. Okay, otherwise you will not do it properly. You are checking whether she's doing, whether the daughter is looking after mother properly, whether she can do the job, or she has got a lot of other responsibilities and she may not be able to do it. Understand? That's why you need to do it. Very good. So, okay, that is history. 4 elements. What are those 4 elements? Okay, what are those 4 elements? Is okay. Ask about weight loss and eating habit. Ask about dementia. Dementia. Okay, mainly how the dementia is affecting a mother, and social history of the mother and social history of the daughter. Then the management comes. I told you this. Okay, this is not a breaking bad news, but there is one element telling that her condition is terminal. That place you have to be sensitive. Okay, right, sensitive. Okay, right. So there are 3 things in the management you need to do. 3 things. Okay, in the management you need to do. Okay, number 1. Okay, the 3 things you need to do. Number 1, you have to explain, okay, why mother is losing her weight. What was the reason for the weight loss? You know the reason. Okay, dementia is the reason. Number 2, telling about the dementia until she has reached the terminal condition. That is the second point. There are 3 points in the management. Third point, we are going to offer palliative treatment and explain what is palliative. The remaining time answering her questions, she got a lot of questions. Okay, that is the approach for dementia. Okay, right, very good. Now let's do the scenarios now. Okay, so these are the 3 points in the management. Explaining why she's losing weight, explain about dementia, and what sort of care, that is palliative care, answering questions. Okay, right. So let's start this one. Greet the daughter. Paraphrase. Okay, I understand your mother has been admitted with this. I understand you brought her a few weeks ago. Okay, I think she has been, admitted for 2 weeks. Okay. If it is not there, you can ask how long she has been admitted, what was the reason. So she is going to tell you, doctors, she started losing weight. So start the conversation with that weight loss. So weight loss is not right OD for her. I told you. You need to ask since when she has been losing weight. Whether this weight loss started suddenly. Do you know how much weight she has lost so far? You can ask what was the usual weight before, generally, and what is her weight now. Okay, whether this happened in a rapid pace or a slow pace. Okay, how did she lose the weight? That is a weight loss discussion. You can ask, what did you notice in her? What did you notice in her? Guys, if you are some of you just listening, you will listen from this ear and it will go, before you eat your dinner. Okay, I've been telling you. Okay, write it. Okay, then you can go through it within next 2-3 days. But write it down. Okay, get the sketch. Okay, get the sketch. Creating your own notes also will create your own authenticity. Because idea is the same everywhere. The way you ask, articulate, and the way you put things forward is different. Okay, that is another advantage of not having notes. Okay, you have the same idea, but different people speak differently. All right? Yeah, very good. But somebody cannot sit here and grasp the idea, then you cannot do anything. Okay, if you cannot commit for this, you cannot do anything. Okay, right. So now let's continue this one. So ask about the weight loss. Then ask about mother's eating habit. So how is your mother's eating these days? Ask, what is she able to eat at the moment? Okay, how do you feed her? Have you tried to feed her? What sort of food that she is able to eat? What sort of things you have tried? Have you tried any liquid food? Have you tried any bottle feeding? Have you tried to feed her with your hand and spoon? Okay. What sort of food she is able to take it right now? What sort of fluids she is taking? Is she taking any fluids at all? Okay. Then how was her eating previously? Like a few months ago, how was it? What sort of food she used to eat? Ask when she was diagnosed with this condition, with dementia those days, how was her eating? How the eating habit has changed throughout this period? Okay, ask about what she have tried, what she is eating, what about other methods of feeding, what sort of food that she is able to take it, explore those things. Okay, explore. Okay, weight loss and eating. Then ask about dementia. Number 2. Understand she has a condition called dementia. How long she has been diagnosed with that? Okay, how long ago? Whether was she on any treatment? Whether is she on any treatment? Okay, whether did she improve with the treatment? Ask, this is the key question. You can ask simply how the dementia has affected her life. Okay, now this is the key question. Okay, this is the key question. Because of dementia, can you tell me, because of dementia, how things have changed for your mother? How things have changed for your mother? Okay, how things have changed for your mother? She will tell you she has become more dependent, she cannot do anything and things like that. Okay, third one, ask mother social history. 3 elements: living condition, mobility, independency. The last one, social history of the daughter. Okay, so what are you going to ask about social history of the daughter? Ask the question, I understand that you are are you the main carer? Are you the only carer? Okay, so what do you do for a living? Do you have any other responsibilities? Maybe do you have any children or any other family members to look after? Okay, so how are you coping in terms of looking after your mother? Do you think that you need some help? Do you think that you need some help? And if we offer some help, do you think that would be helpful? If we offer some help, do you think that will be helpful? Okay, ask, have you ever tried to speak to social services regarding getting some help? Or have you tried to speak to her GP or anybody? Do you think you need some help? If we offer some help, will you accept that? Okay, ask, do you have any other difficulties, any other financial challenges? Ask the financial challenges at last. Okay, right. usually, okay, there's no financial challenges in the UK, but you can ask that, okay. If they have they might have financial challenges. We have some other responsibility and other children and things like that. But no, usually no. Okay, it's not that big. Okay, it's not that big and it's not that. Yes. But what the explanation? One by one. So start like this. Start brought your mother because she has been weight. Okay, understand that. Okay, you brought your mother because she has been losing weight. We have done a lot of tests in order to find out why she has been losing weight. Okay, because we have done a lot of tests in order to find out why she has been losing weight. Okay, why she has been losing weight. Guys, sorry guys, the internet jumped. Time to time internet will jump, okay? That is the disadvantage of online learning. Sorry about that. Okay, but we are now back. Sorry about that. So, right. So, ask. Okay. So, explain about the weight loss. Okay. I understand that you brought your mother because she has been losing weight. We have run lot of tests. We have run a lot of tests like scanning of the tummy. Explain some of the tests we have done here. Scanning. We did an X-ray. An ultrasound. Ultrasound is ultrasound. Okay. Don't say what jelly scan. Okay. No need to say jelly scan. Okay, that is ultrasound is scan. If ultrasound is jelly scan, CT scan is what? Okay, our scan. We have done some scan. All the scan tests came as normal. Okay. So, at the moment, our understanding is that she's losing weight because of the condition that he has, which is dementia. Okay, she's losing weight because of dementia. Right? That is because of the dementia. Then the next thing you talk about dementia. Okay, the next thing you talk about dementia. Okay, you can ask, I understand she has dementia for the last 3 years. How much do you understand about dementia? You explain what is dementia. Dementia is a condition that affects the brain. Okay, and it affects the memory, brain and the memory. Okay, for people with this condition, they will become forgetful. It is a progressive condition. As the condition progresses, it affects the various function of the body. It can affect someone's hunger. Okay, it can also affect. It can also affect, influence someone's body weight. Okay, influence someone's body weight. Okay, right? Okay. It is a progressive condition. It's a progressive condition. Its condition progresses. Okay, it is a progressive condition. Okay. Tell people go through different stages. Now you're going to give the break. You're going to give the news. So give a warning shot. So tell the specialist. Consultant means specialist. Okay, the specialist has assessed your mother. Okay. You can tell the consultant has assessed your mother. Tell, unfortunately, I'm afraid we don't have a very good news regarding your mother's current health status. We don't have a very good news regarding your mother's current health status. Okay, unfortunately, I'm sorry to tell you, her condition is terminal. Or you can tell, unfortunately, I am sorry to tell you, she has a terminal dementia. Or, unfortunately, I'm afraid to tell you, her condition is terminal. Okay, unfortunately, I'm sorry to tell you, her condition is terminal. Okay, the condition is terminal. She will ask you, what do you mean by terminal? So unfortunately, she's not going to make it. So unfortunately, she's not going to recover. So what are you going to offer? You can explain, we are going to offer a palliative treatment. Okay, they will ask you, what is palliative treatment? Okay, what is palliative treatment? Sleep. Okay, so, okay, it's a form of supportive treatment. Okay, it is a form of supportive treatment. Okay, form of supportive treatment. The main aim is to make sure that they are not suffering, they are not in pain, not in distress. Okay, so we try to treat any of the symptom that causes distress in order to improve the quality of life and maintain their dignity as long as they live. Okay, as long as live. Okay, as long as they live. Right? Now they will ask you, why don't you give an invasive treatment? Okay, invasive treatment. Okay, why don't you? Okay, invasive treatment. So why don't you offer an invasive treatment? Okay, so okay, why don't you feed her through the tube? Put the tube and feed. Or okay, peg feeding. Okay, insert the tube in the stomach and feed. The same path structure everywhere they ask. When you talk about supportive treatment, they ask invasive treatment. So you need to tell any of the invasive treatment, aggressive feeding, tube feeding will not be beneficial for her. She will not benefit from it. Okay? It will not be beneficial. Okay, she will not benefit from it. Okay? So it will not be beneficial for her. Even if you tube feed her, okay, even if you tube feed her, the weight is not going to improve. Her condition is not going to improve. She will not benefit from it. Rather, it can cause more distress. What can happen? It can cause more distress. Okay, it can cause more distress. Okay. Explain people with dementia, they can pull the tube. When they pull the tube, okay, what can happen? Okay, so we cannot. Okay, so they can pull the tube and the fluids can go into the lungs. It can cause pneumonia. Okay, and okay, sometimes people can vomit. Okay, the vomiting can go into lungs and can cause immediate danger. So it will not be beneficial. Rather, it can cause more distress, complications. Okay, like that. Right. So what about the feeding? Okay, first thing you need to understand, sometime, okay, letting some people die peacefully is the best thing you can do them. But don't tell them here directly, but you need to understand this. You can talk about nurses have tried some feeding. Tell them nurses have tried some feeding through the mouth. She told her to take a sip of water. So as long as she can drink something, you can give some fluid. Maybe some clear fluid, some juices or some soup, anything that she can tolerate. Some oral feeding, as long as she take it. Okay? Right? If she cannot take anything, that means her body is rejecting the food. Okay, simply explain. Okay, you can just offer, give her whatever she can tolerate and she can take it through the mouth. Okay, as long as she can take it something, okay, you can offer. Okay, yeah, you have that and the idea that, that feeding is not always necessary. Okay, right, good. Now she's going to ask you a lot of questions. Okay, what's a lot of questions? We've got different type of questions. So how can you help me to look after my mom? How can you help me to look after my mom? Okay, how can you help me to look after my mom? So how can you help me to look after my mom? Okay, so how can you help me to look after my mom? So we can offer, okay, different help at different time. Okay, different help at different time. Okay, At the moment, she's with you. So as long as you can, until you look after your mother, okay, until you look after your mother, we can offer help while you looking after your mother. Okay? Then, okay, we can arrange some carers, okay, physiotherapy, occupation therapist, palliative care nurses. With the help of everyone, all these okay, professionals, okay, you will be able to look after your mom. But if that become difficult, we can arrange, transfer your mother to go to a care home. In the care home, the carers will be looking after her. Oh, carers. Okay. In her last days, she can stay in a hospice. She will be provided with the hospice care in her last days. Okay, right. So this is, she can ask, how can you help me to look after my mom? Okay, like that. Now. Okay, now. Okay, next thing. What can I do for my mom? Doctor, when I was young, my mom was looking after me. Okay, when I was young, okay, my mom was looking after me. Right, so I wanted to give that back. Okay, I wanted to give that back. Okay, so what can I do for my mom? So what you can do is mainly, first thing, you can make sure that she has the good place to stay. Okay, she has a very good place to stay. First thing. Okay, she has a comfortable place. Second thing, you can be around her. You can spend time with her and around her. Right? You can show her old albums, pictures and videos, and you can just talk to her about old memories. Okay, those days. Okay, if you can play some instrument, you can play some music. You can just spend time with her. Okay. Next thing, she's going to tell you, sometimes my mom cannot recognize me. She doesn't know who I am. Okay, she doesn't know who I am. She cannot even remember my name. Okay, she cannot even remember my name. And okay, she will be upset about it. Sympathize, I'm sorry to hear about that. But tell people with the dementia, why she's doing, explain. Okay, people with the dementia, okay, people with the dementia, they have a problem with memory. Okay, they have, okay, problem with memory. Okay, problem with memory. Okay, they have a problem with memory. Okay, dementia affects the memory. Okay, so tell, okay, unfortunately, it's the nature of the condition. Okay, they will not be able to remember your name or recognize people. Unfortunately, this can even get worse. Okay, next thing. She's going to tell you, sometime my mom yell at me. She shout and scream. Why is she like this? Again, blame the dementia. Okay, tell people with dementia, they have a problem with communication. They struggle to communicate because their brain function is affected. So if she's screaming or yelling and shouting, maybe she is in distress of something. She might need something. So what you need to do, you need to go and check on her, whether she needs help, she needs something, okay, or she's in distress. Or if there is nothing, then maybe sometimes they might have some unreasonable behaviors. Why? Because the dementia affects the brain. Okay, so either of these. Okay, right. The last thing she can ask you, can I take her home? It is not like Muhammad Ali. Muhammad Ali, you refuse. Like, politely you tell it's better not to, right? But here is the opposite. Okay, you should be able to take her home. But before you take her home, we need to make sure that you have enough support. That you are supported enough, okay, properly, before you take her home. That, you know, so we need to make sure that you have a proper support, you have been supported properly. Okay, you have been supported properly. Okay, before you take her home. Okay, we need to make sure that. So, okay, so we need to take the necessary arrangements. Okay, so social services will come and speak to you and see whether what sort of care support you need. Then occupational therapists need to visit your home to see what sort of arrangement needs done. Then, okay, we also, okay, make an appointment, okay, for the palliative nurses to visit and physiotherapy to visit. After made all the necessary arrangement, you should be able to take her home. Okay, right. So answer, you should be able to take her home. Before that, we need to make sure all the necessary arrangements are made. Okay, that is, okay, this is dementia. Dementia is the easy part. Okay, easy part, guys, is the easy stuff. Right, but study. The same dementia, they have a different one as well, dementia 2, with some slight changes. Okay, and this is the one more popular than the previous one. Okay, you see the purple scenario. That scenario we went through. Then we have a, okay, another one. This is a, okay, blue scenario. See the difference? It's everything is same. There are some differences. Okay, everything is same. The medical unit, she has been brought due to the weight loss. She has dementia. She's not taking any food. The doctors have done the investigations. But they didn't mention this one. Which one? The nurse have given a sip of water. She told her to take it, not there. That means the treatment is going to be maybe nothing. But she's very weak, medically managed, no further invasive aggressive treatment, all there. But in the previous one, here they mentioned palliative care has been decided by the consultant. What is written? Palliative care has been decided by the consultant. Okay, right. But in this scenario, rather they didn't mention that. Rather than giving palliative care, they mentioned discuss the end of life care with the daughter. Okay, here they have mentioned like discuss the end of life care with the daughter. So the plan is, history taking is the same, the 4 elements. What are they? Okay, the initially weight loss and the eating habit. Ask about dementia, number 2. Number 3, ask about social history of the mother, social history of the daughter. Okay, management part. Explain why she's losing weight. Explain dementia and her condition is terminal. What are we going to offer is the different one. We are going to offer her end-of-life care. End-of-life care is different from end-of-life discussion, okay? End-of-life discussion, maybe someday, okay, we discuss about it. This is end-of-life care. What is end-of-life care? Okay, if you look at this diagram, I tell you. Okay, end-of-life care is more and more sophisticated form of palliative. Okay, this is why people progress usually. They will be in a palliative, they come to end-of-life care, then finally they go into hospice. Okay? Right? Right. Become hospice. Okay, right? So here, you need to tell what we are going to offer her end-of-life care. What is the definition of end-of-life care? Okay, write it down. You need to know the difference. I'm going to tell the difference now. listen it properly and write it down and don't ask me again. Okay, some people when I teach, they don't listen and they ask again. Okay, end of life care. They will tell you discuss the end of life care. So end of life care is same as palliative for 50%. It's a form of supportive treatment. Okay, but end of life care in the England, United Kingdom, we have 4 countries. We have England, we have Wales, we have Northern Ireland, and Scotland. Okay, so we have 4 countries. Okay, but we talk mainly about England. So in England, I can tell in our country, we offer end of life care in the last, only in the last 1 year of someone's life. Okay, right. If someone can live for like 3-4 years, they can be on a palliative for 5 years. But the end of life care will start in the last 1 year. Understand? Right. So in the last 1 year, we offer, it's a form of supportive treatment. When we offer, when all the life prolonging treatment become ineffective. Life prolonging treatment become ineffective. In palliative, there may be life prolonging. They do some surgery, some chemotherapy to prolong someone's life. Here, all the life prolonging treatment become ineffective. Okay, what sort of treatment? All the life prolonging treatment become ineffective. I don't know, somebody's raising hand. I don't know, maybe she came late to the class today. Okay, so when life prolonging treatment becomes effective, right? So okay, right? Okay, right? So when all the life prolonging treatment become ineffective. I don't know why he's raising hands. Okay, if you have a question later, madam. Okay, so all the life prolonging treatment become ineffective. Okay, all the life prolonging treatment become ineffective. We tend to offer a supportive treatment. Okay, in the last 1 year of someone's life. Okay, the aim of the treatment is going to be the same. Okay, what is the aim of the treatment is to make sure they are not in pain, not in distress, in order to improve the quality of life and maintains their dignity. Okay, maintains their dignity. Okay, the remaining is the same. The questions is the same, everything is the same. Again, I can tell you, okay, what is end of life care? It's a form of supportive treatment. Okay, we offer this supportive treatment in someone's last days of someone's life, mainly within the last 1 year. We tend to offer when all the life prolonging treatment become ineffective. There's no life prolonging treatment in this. We just try to offer only supportive care in order to improve the quality of life and maintain their dignity. Okay, so in that, we'll try to make sure that they are not suffering. We try to make sure they are not in pain, not in distress. Okay, in order to improve the quality of life and maintain the dignity. That is the same points everywhere. Okay, that is the end of life care. Okay, that is what? That is the end of life care. Right, good. So that's it, okay? I'm going to call this, okay, all the breaking bad news. The remaining breaking bad news, I will, okay, if I get the time, I will go through at least a summary, okay, maybe in the next weekend, okay? I don't focus too much on breaking bad news these days, okay? But I will ask you to read. You have done the fundamentals of breaking bad news. Okay, the fundamentals of breaking bad news is, okay, the breaking bad news is this. Okay, and the 5 steps. First, you take a paraphrase. After paraphrasing, you take a history. History taking either incident or prior knowledge or signs and symptoms. Then risk factor according to the pathology and social history. Maybe if you are dealing with the patient eyes, then this is the core part. This is the climax. This is where you can really show your talent. Okay, so okay, invite, narrate, and warn and tell the news. So okay, unfortunately, I'm really sorry to tell you, and you tell the news. Then you wait for the reaction. You support the reaction. Then you lead the talk. Let me explain to you what we need to do for him. We are going to offer palliative treatment. They will ask you what is it, or whatever the treatment is mentioned. Then you explain how is it, what is included in the palliative treatment. They will ask you some questions, answer the questions, and you do it. Okay, that's what is done. Okay, right. That is about breaking bad news, right? The second topic that we're going to start with. You guys have been asking for break. Okay, what is the time now? Okay, wait, okay, you can take about 10 minutes break and come back. Okay, take 10 minutes and come back. And when you come back, what we're going to do, I'm going to start with some of the scenarios. They are called roundup scenarios. Okay, I name it as a roundup scenarios. There are some random scenarios. Okay, there is no connection between these scenarios. I have carefully chosen some scenarios, okay, in order to discuss. The reason that I've chosen this scenario, you may be making some mistakes, okay, or maybe struggling to diagnose, or you may be not telling the proper management. So we're going to talk about different scenarios. They are not connected to each other. Okay, there's no connection. Okay, yeah. So they are called roundup scenarios. Some random scenarios. Okay, some random scenarios. There's no connection. So we're going to start that now. Okay, you can take a 10 minutes break and come back. Okay, bye bye now.